Well, good afternoon, everybody. Welcome to what is the final session in what has been an incredible program here. Today we'll be focusing on an important topic to so many, and thank you all for being here and streaming in. We'll be focusing on the topic of fueling action for mental health. This is a topic which has gained increasing attention, and rightfully so, all around the world over the last few years. And mental health conditions are one of the leading causes of health burdens around the world. And yet for too long, it has been overlooked, underfunded, stigmatized, and there is a huge global need. As we've heard right across the conversations here at this special meeting, from conflict situations to the workforce to productivity, we know that around $16 trillion will be lost if we don't prioritize mental health between now and 2030, and it's something that impacts so many of us. So thank you all for being here. We're going to have a really fascinating conversation with our esteemed panelists shortly. And just before we do enter into the conversation, I wanted to remind everybody here, please make sure your phones are switched off. And as we have a conversation here, we'll then shortly open up to some Q&A as well to have a really interactive conversation with you as the audience. So with that, I just wanted to frame a little bit of the conversation here today. Given this huge global need, we have an opportunity both to look at some global solutions and also here in the region. And we wanted to really focus today's conversations not only on the need, but also especially on the solutions. We wanted to delve into the role in particular that cultural community and artistic expression can play in increasing awareness of this important issue, but also integrate it into therapeutic solutions. We wanted to focus on some of those practical solutions and have a conversation amongst us all around what does collaborative, practical action look like. It's my absolute pleasure to introduce here our very esteemed panel. Here we have Rowan Al-Majiri, a clinical psychologist in training and a global shaper with the World Economic Forum in the Muscat Hub. Thank you for joining us. We then have Dr. Mansour Al-Rahmani, General Supervisor for the Deputyship of the Labour Market Affairs and Human Capital Development at the Ministry of Economy and Planning. Thank you. And then we're delighted to be joined by Dr. Hamad Al-Dray, board certified neurologist and a global shaper here in Riyadh. And we're delighted to have Mazen Rukini, who's co-founder of the Labia app. Many of you will know as a leading mental health solution right here in Saudi. And just before we open up for conversation, we wanted to start with something a little more engaging for you as an audience. As we think about mental health, it is something that is important globally for our economy, it's important for families and communities, and it's important to us as individuals as well. So I just wanted to invite you all to take a moment and think about someone in your life and ask whether yourself or somebody you know has struggled with their mental health, say within the last 12 months. And if you're comfortable, whether you'd be willing to raise your hand. Thank you. There's a recognition around 1 in 4 people will struggle with a mental health condition in their lifetime, and those numbers are increasing. And as we do this, we wanted also to encourage everyone to say that this can be a difficult conversation if it's something that you're personally struggling with. So I wanted to make sure this is a very safe place for everybody. If there's anything that makes you feel uncomfortable, feel free to leave the room. And as we'll hear from the Labia app as well, please make sure you can reach out to talk to somebody. And we'll hear very shortly about a solution that's anonymous and online that you can speak to. So with that, I'm delighted to open the conversation here. So, and as we think about mental health, I love the World Health Organization's definition of mental health. We wanted to focus this conversation on health. So mental health is defined generally as a foundation as the state of well-being in which you have the ability to cope with the everyday stresses of life, contribute to your society, and be productive. So let's keep that in mind as we go through the conversation today. So with that, I'd love to start with Hamad, if I may. As a board-certified neurologist, could you give us a briefing on a little bit more about how mental health and the brain interact with each other to ground our conversation today?
Of course. Assalamu alaikum jami'an. So first, if the question is, what's the state of mental health? I can tell you that 20% of the youth had an element of anxiety in their lives. 30% of youth had an element of depression in their lives. And about 40% of youth should or would have an element of mental wellness issues or struggles at one moment of their lives. But if we shift this question to a different spectrum and we ask, what's the state of well-being? I can tell you that 60% of the youth don't really have an enjoyable workplace. 80% of the youth are not sufficiently physically active. 70% of youth are having sleeping problems. 60% of youth are struggling financially. So that just gives you the context that well-being is not a given, but it's something that we should work on, we should develop in our lives, and we should create with our habits. Now, since everything we react to is basically a perception of our minds and our brain structures, and as a neurologist, I'll give you some fun facts of my favorite organ. So we have three vital structures in the brain that are related to well-being, and I'll try to keep it very short and straight to the point, but we have the center for judgment and decision, and that's the prefrontal cortex, where we decide what is the best solution. And then we have the amygdala, which is the center that decides our emotions. It makes us happy, makes us sad, makes us angry, and whatnot. So it modulates our emotion. And then we have the third structure, which is the hippocampus, and it's responsible for storage of memory. So all our experiences that we have in life, it turns into memories, and we use that as a resource. Now, when all these structures are working together, we have balance, and once we're balanced, we have a proper mental wellness. We're able to take action whenever things are affecting us. But when there's an imbalance, let's say the prefrontal cortex is not giving you the right judgment, you can't judge how happy or how sad you should be. And if you don't have enough experience, you don't have a storage of memory, so you really can use the hippocampus to guide the amygdala of how happy or what kind of emotion you should have at this specific situation. So again, from a neurological point of view and from a lifestyle point of view, well-being is not a given. We need to create our own well-beings by doing our habits, routines that creates the right well-being for ourselves.
Yeah, that's a great way of framing this. So we need to create and invest in our own mental well-being to make sure that that is a reality.
Exactly.
We often talk about promoting good mental health as that active investment in good practices, but also reaching out for help when maybe we're struggling to get the help that we need. With that, I feel like it's a good kind of segue to come to you, Aaron. As a clinical psychologist in training and the work that you're doing, how can we think about that artistic expression and involvement of culture within promoting that good mental health, or even within the therapeutic approaches that you've seen in your work?
Thank you for that question. As we all recognize, culture plays an important role in the way we form and shape our identity. And we also recognize the way the role culture plays. We also recognize the role culture plays and the role artistic expression and creativity kind of are the building blocks in fostering compassion, and compassion is really important. It's a core element of mental health. It's a core element of how we practice as mental health practitioners as well. So if we were to think of how we could bring those into the therapy room, they could kind of be therapeutic tools to enable us to create safe spaces for our clients, for our patients. So kind of an example of that is in societies like ours, for example, and around the world as well, there's a lot of stigma associated with mental health, and some of that stigma can kind of create barriers for people to seeking support because there's a lot of shame, there's a lot of guilt associated with that. And I think if we were to bring in forms of artistic expression into the room, they can help us break down those barriers, because they can enable people who wouldn't otherwise kind of be able to express their emotions, and it can be kind of through other forms and through other tools as well. And I think it could also enable kind of and foster the therapeutic alliance. So if a therapist were to kind of be curious in the therapeutic room, if a therapist were to drop their assumptions, drop their judgments around the person's culture, and try to create understanding, try to create meaning, to foster dialogue, that would create a safer space for that person coming in to seek help, because they'd feel a form of connectedness into the room, and that will retain clients in therapy a lot longer, which in turn would make their therapeutic experience more effective.
I think that's great. And you've seen some of this in action, haven't you, as
Yes.
well? Do you want to explain a little bit more around what you've been curious about in this space?
So maybe a note to put out that I'm not an art therapist. There are accredited art therapists, but I do have an interest in art, and I do believe that we can use art as a tool to empower people. And I think bringing art into the room is something that I've learned to use maybe 2 years ago now, and I find it a very powerful tool to enable clients to express elements of themselves that they wouldn't otherwise do so. So I think, I'm not sure if you asked me to name an example, but I could give an example of that as
absolutely.
well. So I think one example of that is the role of storytelling and narrating. So one of the therapeutic tools I came across, and it originated from South Africa, is a narrative therapy tool called the Tree of Life, and I don't know if anyone in the room has come across it before, but it's a powerful tool that's used to help people tell their own story. So if we enable people to take ownership of their story, if we enable people and support people to try to create understanding of their experience without judgment, with curiosity, without that implicit bias that can sometimes come into the room, then it empowers people to take ownership of that story and to be proud of it, and to kind of build on their resilience in the context of distress whenever that comes along. So that's something I found quite powerful, and I think bringing it back to the Middle Eastern context, I know in Oman, for example, and in Saudi Arabia, there is a huge cultural importance of storytelling. So that could be something kind of powerful if we try to bring some of that into the therapeutic room as well.
Yeah, that's incredible. There's a big kind of recognition that community-based, culturally competent care is so important today, and as all around the world. And so it's a great example. Thank you. Yeah. So just would love to talk a little bit more about another tool for both reducing stigma and increasing access to care, which we know is a challenge here in the region, but also all around the world. Mazan, if I may come to you, reflecting on your experience at Lebe, how can digital play a role in accelerating action, both at reducing stigma and also access to support?
Yeah, sure. So when we talk about mental health, we talk about two sides, the supply and the demand. So going to the demand, as Dr. Hamad mentioned, 30% of people, and I'm sure that we have people here in the room, they suffer from mental health issue at least once in their lifetime. And only 5% of those people, they seek help. And that's because almost 60% of youth, they struggle to have access to high quality mental health. And this is why the digital tools and also the application makes it easy for people to have access to mental health services. That's talking about the demand. And talking about the supply, there is only, in half of the world, half of the countries in the world, there is only for mental health workers for 100,000 people. So just imagine if you are in a one big stadium, and there is only one mental health worker that is taking care of all those people in that stadium, and that's a very low ratio of social and mental health workers in the community. So in Lebbey, we managed to actually have to fight the stigma, and we knew that our big challenge is actually not only making the online tools, but also to fight the stigma that is in society. We have now 3 million users in the application, and more than 1,000 therapists in the application as well. We provided around 70 million minutes of counseling in the application, and we think this is just the beginning. The market size of mental health, of digital mental health, is now around $9 billion, and it is expected to be around $70 billion in 2032. So having that mentioned, there is going to be a huge shortage in the supply side, and that need to be covered by a lot of initiatives by governments and the private sector as well.
It's incredible. And Lebbey has only been in place since, you said, around the year 2000? So in 4 years, 3 million people.
Yeah.
It just shows how needed that is. And do you have any examples of the interventions that you're providing and the impact that they're having on the well-being of users?
Yeah, sure. Since we started, we didn't want people feel that they're alone. So you're not alone. We started, one of the things was we called it Lebbey Community. It's a very safe place, let's call it a social media place where people go and they post about their mental health issues, and they get support from other people in that community, and also from the therapists that we have in that app in Lebbey and also that community. And until now, so far, we have around 20,000 people in that community supporting each other. And that actually was really shocking for us. People are really in need for that safe space to express their feelings and to share their experiences with the mental health issues and so on. The other thing is that the assessment. So we had around 5 mental health assessments in the mobile application. 2.5 million people have took those assessments, and they're actually are getting more motivated to ask and seek help for mental health after they took the assessments, and they knew that they maybe need some help from the therapist or psychiatrist. So either online or offline.
Amazing.
Yeah.
And if I may come to you, Mansoor, how does the Ministry of Economy and Planning think about and prioritize mental health? We can see how the need is increasing and the users are increasing. How is the ministry thinking about this, particularly within the context of human capital?
So thank you. First of all, very happy to participate here. The Ministry of Economy is not an expert on mental health, like psychologists and clinicians and providers, but it's really always very healthy to hear the frontline perspective on things. In the ministry, we view mental health from 2 things. Well, first, what is the economic impact of mental health conditions on the economy? And 2, this is at its very hardcore a human capital issue, right? And maybe I can take a step back and say that, in the Ministry of Economy and Planning, whenever we're asked to analyze a policy issue, we really do 2 things. We prioritize consistent data collection on the issue, and then we always promote policies that are evidence-based, that it should work and what works and what doesn't work. Having said that, and I think it's been said here, for the past 10 years, when you look at the mental health landscape in Saudi, 1/3 of the population, 1/3, fit the checklist of having a mental health condition. Yet 5%, as Mazen just said, seek treatment. Furthermore, 83% of people with severe mental disorders do not seek treatment. This is not unique to Saudi. We continuously see this mismatch between prevalence of mental health conditions, and seeking care. But think if this was a broken leg, or diabetes, and you're not actively seeking care. You're going to have economic impact of absenteeism. We're talking about $16.5 trillion US dollars by 2030 globally. That's going to be due to the mental health impact, right? The question also is, this is a socially determinant issue. I know that there are certain conditions, and Hamid might tell me this, that are biologically determinant, but this is socially determinant. It's about your living conditions, your income, your wage, the housing environment, the family support, the social networks, right? This is where your mental health is determined socially, right? So if you look at the human capital life cycle, I think there's an issue also in early childhood development. We have to start early, right? Look at pre-primary enrollment rates in the country. Not great. We're talking about 20% of pre-primary enrollment, although we know that for every dollar invested from birth till the age of 8, your return on investment is somewhere between $7 to $12. And we fall short in early childhood education. We're seeing women participate in the labor market, which is phenomenal, from 12% to 36%. But what about childcare, daycare? Where's the private sector when it's providing the structural elements that really could enhance this early childhood development, right? These are issues that we really need to talk about. Aging, the aged population, inclusivity, lifelong learning. Once people retire, what are they going to do in their lives? How do they feel that they're part of the community? How they're going to be productive? So at the ministry, we look at it, A, as a human capital condition, and human capital has a huge part of the human-led economic growth. 2, it's a life cycle approach. It's socially determinant, although there are some biological determinants. And 3, when we talk about solutions, I guess in the next part of this discussion, is what are we going to do about it? And these are the ways that we view it. Obviously, we partner with the Ministry of Health. We partner with a lot of ministries and stakeholders in the government to work on this.
It's brilliant. So that point of the solutions, we can see how important this is. We've heard a lot of statistics as well. And just to add in something here, I think we can often talk about statistics. We hear the huge loss. We see the personal impacts. We know it individually. Just to add one personal story, which I think is I suffered a trauma in 2013 that took me out of the workforce, and it was with mental health support that I could re-enter. We're seeing a lot of trauma around the world right now. We're seeing a lot of need here. I think this is an important issue more than ever. And accelerating action through collaboration and solutions that are evidence-based and works is really where our effort needs to be now in all regions of the world. So with that, I'd love to just switch gears a bit and focus in right across our panel on what solutions do you see working, and particularly what solutions lend themselves and need much more collaboration together. I might start with you, Ryan, on as we think about in the MENA region, the diversity of need, the diversity of solutions, some of those arts-based and cultural expression solutions we talked about earlier. What do you think is needed here?
So I want to reiterate what was being said is that there needs to be spaces for more dialogue, for more collaboration. And I'm on this panel today, and I'm in this meeting as a voice of the youth to represent the youth. So there also needs to be spaces to empower the youth, to take initiatives that can help kind of drive this force as well. So how can we enable the youth to reach communities to help spread awareness on these issues? Because one of the main issues that we experience, so we've seen the mismatch between the numbers, and one of the main issues is the stigma associated with help-seeking behaviors as well. So we know that people are suffering, and we know that people aren't reaching the places where they need to be to get that support. So how can we enable those people, and how can we empower those people? And I think the youth have a lot of ideas. The youth have a lot of initiatives. They just sometimes need a push. And we can do that through various means. So I think art and culture are great means to start with. So I know Saudi Arabia kind of hosts a lot of different forums and events for the youth that are surrounded by arts and cultures. So we can bring in that dialogue in those spaces to kind of normalize some of those some of those issues, to kind of validate it for people who are experiencing those issues, and for people who tend to attend spaces like that often as well. And I think one of the other things that I wanted to mention is we can also empower people through various means, such as education. So if we train more people in kind of clinical roles, in research roles as well, we can come back and start to begin to understand what might work in our communities, what might be different in our communities. Do we need to alter some of the therapy? So we rely a lot in therapeutic practice on the gold standard evidence-based therapy. And a lot of the gold standard evidence-based therapies are based off of Eurocentric research. So a lot of the populations that we look at are based in the West. And recently, a lot of emerging data has been coming out from all over the globe. And recently, a lot of new data has been coming out of Saudi Arabia as well. So as part of my research, recently I've been interested in the psychological influences or impacts of long COVID as well. And so we were trying to gather and synthesize some of the data that was available globally. And on a global scale, out of 32 studies, looking at a niche symptom of the psychological impacts of long COVID, we found that 12% of the research was coming out of Saudi Arabia. So already Saudi Arabia is kind of paving the way for that. And I think if we begin to develop an understanding and create means to develop that understanding, we can come back and create therapeutic practices that might be more effective in communities like ours, because they integrate aspects of our identity and they give us a sense of belonging. So that could be one avenue to be taken as well.
So many points there. And the data, I can see Dr. Yasmin here as well, who's been leading a lot of the data generation in this country. There was also a recent research, first of its kind, coming out just this last month on suicidal attitudes and behaviours in the region, really for the first time. So we are seeing that kind of leadership and knowledge to know how to address some of these issues coming out of Saudi, which is incredible. I just want to ask you one other thing, because I would love to, some of our talks around this as well. Another solution around accessing resources that have often come from other countries, and how relevant are they here? And what are some of the things that can be done to make sure that they're culturally relevant, but even accessible in the region?
So create platforms, similar to what Labbe is doing as well. So create platforms where these resources, these pieces of information can be reached out to a wider population, because these are platforms that people access on a daily basis, and deliver that piece of information in a way that would reach people better, in a way that would be culturally significant. So I've been recently following their page, and I've been following it for a few years as well. So they tend to do that as well. So I think we should encourage a lot of different platforms such as that to be able to reach our communities in the way that can kind of have a more significant impact. Yeah,
absolutely. I might actually, with that, come down to you, Mazen. What opportunities do you see for accelerating action using technology and innovation, and what role does collaboration have to play here? How do you think we can collaborate better?
Yeah, sure. So we have been asking ourselves this question, and going maybe back to the point that Dr. Al-Mayyan was saying, which is how can we make help or how can we help people live longer, healthier life. And that's not only about mental health. I mean, we can easily help people through adding more therapists into the market, but maybe this is not the way that we need to do it. It's more into the preventive side. How can we prevent people actually from having the mental health disorders at the beginning? And that could be through many ways. Maybe one of the ways is actually AI, and having AI-powered tools to help people have healthier lifestyle, and also have a better way of actually interacting with the therapist. And maybe the other things, also having more investments into this market. Investments by the government through rolling out some screening into schools and maybe primary cares places. And also investments by the VCs as well. Having more investments into the private sector to help startups to raise awareness and actually to provide services for the society. One of the things that's worth mentioning is actually 80% of our users are female. And that's not because they have more mental health issues, but because they are more open to talk about their mental health issues into the platforms. And one of the ways is actually raising awareness into the society as well. One of the campaigns that we did reached around 1 million views in the MENA region. And this is one of the ways that we think will really help raising the awareness and actually destigmatizing the mental health in the MENA region.
Brilliant. Thank you. Hamad, I might come to you now. As we think about collaboration in the region, there are a number of solutions I know you've been thinking about and involved with. Where do you see greater need for collaboration?
Okay, so I'd like to actually collaborate with the audience and everyone online. But first, I'm just going to say a quick story. So there was this one lady who works in a very big company. She was tasked to do a presentation. She spent all yesterday preparing for the presentation, and she was very excited. She got into the meeting room, and not just 5 minutes into the presentation, her boss gets up, says, "You are clearly unprepared. This is a waste of time. Please call for another meeting if you're ready," and just storms out. So, of course, she was in shock. She stayed in the room, frozen, until one of her colleagues went in and saw her and saw the scene that happened. And her colleague said, "Well, of course this happened. You're a disorganized person who does not prioritize the work, and you procrastinate." So that's a shock for a colleague to say something like that. But what if I told you that that was something that she told herself? In actuality, we have something called negative narrative. We have a bad self-talk to ourselves. And without pointing fingers, I'm sure everyone had that moment. We did something bad and, oh, we deserve to feel bad. So when it comes to the brain, it's very difficult to convince our brains otherwise. And when we're in this situation, we're feeling weak, we're struggling, or if we see someone struggling, I like to collaborate again with you to do something called emotional first aid, something to help yourselves and something to help others. So in order to have a very strong health well-being status, we need to look at health well-being pillars. So number one would be physical. Am I having a fit body that is, I'm treating it well? Second, it's motivation. Am I motivated? Am I hopeful? Am I making plans for the future? Third is intellect. Am I stimulating my brain? Am I with the right people? Am I interested in what's happening in the world? Fourth is spiritual. Am I having a purpose in life? Is there a purpose in what I'm doing? I have to feel something to get out of bed in the morning. And the fifth is social connection. And social connection is defined as your relationships that you have with others, that you meet regularly, and you invest your time and effort with them. And I'll stop at social connection because it's one of the most important parts. And a research was done in Harvard, and one of the longest studies in the world, 85 years of research data, showed that those who have positive social connections and relationships are those who live longer, happier lives, and healthier lives. And finally, of course, we must have emotional resilience. Emotional resilience is basically helping yourself and others to develop the strategies that helps you in your dark days. Because in the dark days, you're weak, you can't really think, you can't really work with anything. You just need to activate a plan. And that plan needs to be prepared firsthand. So be an advocate of emotional first aid. We can't all be clinicians, we can't always be expert people, but we can learn to be strong in emotional first aid to help ourselves and to help others if we see any of these 6 pillars of health and well-being imbalanced.
That's a brilliant thing for us all to take away, to be able to take action here today, if you haven't already. So emotional first aid.
Yes.
Another area I just wanted to spend a little time on is the workplace. So within the workforce, we know mental health is becoming more and more important, including in this region. What are some solutions you're seeing that are working in the workforce? And again, how can we come back to that question of how can we continue to foster collaboration there?
Sure. I won't spend so much time in the workforce. Yeah. Workforce for me is something that's very close to my heart because most of the youth, they really have issues with mental wellness in their workforce. And a statistic that is actually surprising for me, 83 of organizations and companies have mental well-being and wellness departments. However, 81% of employees usually say that they're not really benefiting or they're not emotionally well in organizations. So there's clearly a disconnect. Something's not working. So when it comes to the workforce, and I'm speaking to organizations and companies, there's the 3 killers of economy. You have burnout, absenteeism, and presenteeism, and Dr. Mansour spoke about it briefly. I'll just say that burnout is basically when you're emotionally, physically, and emotionally completely stressed out. And that costs the economy millions of lost hours and lost dollars into the economy. Absenteeism is when you really cannot show up to work because of the stressors. And that also costs the economy. And then finally, presenteeism, which is mostly the biggest problem, is when people are there, but not really there. The emotions, the stressors are carried throughout, and they really can't be efficient. Do I have a solution? Do I have an answer? No, but I have a question that I'd like everyone to start thinking. How can we solve for an invisible condition? I really can't see my friend who's going through something that is invisible. I can't really support them. But if the other colleague is having a headache, I can clearly see it. I can see the physical characteristics, and I can reliably give them time off. The only solution that I think is beneficial is whenever you're feeling the overwhelming load of work, take a step back, stand up, and walk. The moment you walk away from work, you disassociate yourself from all the triggers and stimuli that are usually associated with the overwhelming sensation of the work. And when you take a walk, and subhanAllah, the brain really resets with movement. That's why we always encourage physical activity. And the movement you do walking around your office department and coming back helps you reset your mind, decrease the stressors and triggers that you're having, and come back with a more clear mind. And that's something I hope everyone can start to do at work. And maybe we can have a bigger discussion and dialogue about how we can solve for the invisible condition. And please start having that dialogue with your employer, because this disconnect that we're having is a big problem. And as I usually like to say, work has to work for you.
I also have another thing to add, maybe another solution to that as well, which is Labbe business. We do have a program that is for corporate wellness as well. In Saudi now, we do have more than 10,000 employees now having our corporate wellness programs, and this is really increasing awareness in corporates in Saudi. There was a study last year that shows that there is an increase in Google search for the article, "How do I improve my mental health in young generations," and also in employees specifically. And that's maybe one of the ways that Labbe business can help the organizations as well.
That's brilliant. And just to add another one on there, one encouragement, one thing we've seen globally as the workplace mental health conversation is developing, and we're learning more about what works. One thing at my organization, Prospera, we do is company assessments. So you can actually look across and assess where the risks are and really start to understand where those challenges are and then address them directly. So there are some great solutions for everyone, but really taking that tailored approach to understand and address those specific challenges, both at an individual level. That's why we seek out help with that specialized support, but businesses can do it as well. And with that, I'd love to actually, as we kind of round this conversation on solutions, then we'll come to audience question and answer session. And so I'd love to come to you. How is the Ministry of Economy and Planning thinking about these solutions? And again, that collaboration, government has a very important role in facilitating and supporting and leading a lot of conversation and collaboration. How are you thinking about that at the ministry?
Sure. And I mean, this was a really beautiful discussion, very stimulating to even think about more innovative solutions. But I think let's start first with the health system, right? So in Saudi, 4% of the budget on health goes to mental health disorders, which is above the global average of 2%, but less than high-income countries of 6%. We have around 20 mental health professionals for every 100,000, more than the global average of 6, but also less than a high-income OECD country. So the question becomes, for health systems, and this is for the Ministry of Health, for the Saudi Health Council, for people involved in health, how do you create a health system or a policy that promotes or enables people to present themselves to the healthcare facility, get screened, and receive treatment in a timely and efficient manner, right? And given the statistics we heard, that's an issue. But you can increase the budget, you can increase the training for mental health professionals, but our view is that it's about removing the time barrier and the administrative barriers for seeking care. And we've all been through this. You go see a primary care doctor, you get in one location. Then you go see a specialist in a different location, gets assessed again. Your medications are prescribed in another location. As long as you ease the administrative and timely barriers for care, you have a higher chance for people to stay in treatment programs and seek treatments, right? And Labbe is one of those solutions that can help because it really promotes that idea of removing those barriers for care. And I think the health sector transformation program for the Ministry of Health, I think the mental health strategy, I didn't know Dr. Yasmin Twedri is here, so she's the pioneer on this. These are strategies that are about that, right? There's prevention, screening, access, and that's within the health system. Now, also, I'd like to talk about substance abuse because it is an issue. We don't have a big number, but it is an issue. Mental health causes substance abuse causes mental health, right? And I think we really need to start having a very serious conversation with our partners in the Ministry of Health, in the Ministry of Interior, about strategies to really introduce rehab, long-term care, introducing people who have substance use disorders back into the society, back into being productive agents of change. And this is a very important conversation to have, and I think evidence and policies in countries outside of Saudi are working, and we should be able to leverage that. The third thing, I think, is going back to the human capital conversation, right? And the social determinants of health. You know, we have so many programs that target people who need services, cash transfer programs, subsidies, Dhaman or the social insurance, and the populations who utilize these services should also receive mental health screenings. And we should package mental health interventions with cash transfer programs, with lifting people out of the cycle of poverty in order to actually enable them to participate in the labor market. Saudi's median age is 29. Young, very young population, about to enter the labor market, about to be employed. If we're not ready and equipped with the skills, with the mental health environments, that's going to be an issue. Finally, I think one of the themes of this special meeting is global collaboration, right? And we have a very strong presence now in the international stage. Yesterday, His Excellency Rabia signed this beautiful agreement to lift more than 33 million people out of poverty, right? Think of this, 59% of people living in extreme poverty in the world in 2030 will live in conflict-affected areas, war zones and conflict. And unless we package mental health interventions with poverty reduction, it's not just cash transfers, it's not just subsidies, it's about really dealing with trauma, dealing with the issues of war. That's going to be a huge burden, I think, to human capital outcomes globally, right? And leveraging the technology as well, right? We hear today that AI doesn't have empathy. It doesn't have empathy, but it does have things that could help Hamad in his clinic see more than 50 patients rather than 10, right? It could ask about history, presents the paper for you, and then have more efficiency in dealing that and less waste. So I think it's a very complex issue. It's all about collaboration, partnerships with the public sector. Private sector has to step up, whether it's social responsibility or investments in rehab facilities, in long-term care, and really collaboration with academia and academic institutions. Give us the research, right? It's beautiful that Saudi is leading, but give us the research, give us the evidence so that policymakers can utilize it to advance this agenda. So that's kind of in a nutshell where we are and how we think when we're dealing with this issue.
Thank you. And I just wanted to, before we go to question and answers, just pull up that point in those packages and global collaboration, that integration of mental health support into communities that are particularly affected by trauma or even in situations of poverty is not as common as we might think it is. So thank you for acknowledging that. It's quite a powerful contribution to be made. Just for some context, we heard, could you remind me, Mazan, how much is in the private investment capital for mental health technology? It's billions, trillions? How much?
Yeah, in 2022, there was a 70% increase, I think, in the US in the digital mental health. And I think also here in the MENA region, there is a very huge increase in the investment as well in the mental health. And there is also a huge pharmaceutical companies entering the market of mental health as well. Because right now, we are in the era of one size fits all. Like if they have a problem, then maybe there is only one kind of medicine for all the disorders. But I think using and utilizing AI for that by the pharmaceutical companies, that would be changing way faster. And having more investment into this would be changing way more faster.
Yeah, absolutely. And I do think we've seen the private sector see that acceleration of investment a lot faster than we have, say, in humanitarian settings and for those that aren't in those markets yet. And so just wanted to pull, it's a really valuable contribution to the discussion. We heard Sigrid Kaag say this morning in the context of a Gaza reconstruction, mental health will be important. I just wanted to highlight this is new. It's a really important discussion, and thank you for raising it.
And if I may, we talk about climate change, right, a lot. Climate-induced migration, right? We're seeing people going through forced displacement because of the change in natural resources, especially in West Africa, Sub-Saharan Africa, is going through one of the biggest forced migrations that we're seeing. 2 million and 3 million by months. So the question becomes, the spillover effect of this forced displacement on the economy, on the global economy, is going to be huge. And unless you really start thinking about mental health packages, we spoke briefly about, having those line items and funding.
Budget-specific line items.
That's going to be one of the huge challenges that we're going to be facing, I think, when it comes to the humanitarian landscape.
Agreed. So the total aggregate global humanitarian spend for mental health is around $300 million for all countries added up. It's a very, very, very small amount compared to the private investment. And so Yeah, getting that as a line item, as a priority, is going to be really powerful for those that need support all around the world. So with that, we've had a fascinating discussion. We'd love to open this up to the audience. For any questions, please direct your questions to the panelists, and if you could keep it to a question, we don't have too much time, rather than comment, that would be fabulous. Yes. Would you mind introducing yourself as well?
Hello, everyone. My name is Rasha Al-Naji. I'm an aspiring researcher, and I'm particularly interested in using video games to assess mental health. I've done some research, minor, since I was in high school at the time. The problem has been raised. There's not enough social workers out there to give help. And we can see that, especially in adolescence age, there is a reluctance towards going to a therapist and to getting help because of the cost and the social stigma. So using video games is a solution when you ask what other solutions can we have. And Labbe, I've been watching your work and I'm admiring everything that you do. Thanks. So I wanted to just point that out. Thanks. So the problem is today, where do we stand ethically when we say using AI, not particularly in video games, but in the field of mental health? I've heard from a lot of experts that even if it's accurate to 99.9%, there's always that 0.01% that will make an issue for us to use AI in mental health. I would love to hear from you experts about this issue.
I'll just have a brief answer and then to you, Dr. Hamid. So will AI replace the therapist? I think no. I think they will not be replaced, but they will be working way more efficiently, and it will help them a lot. And maybe that's the first part of the answer. Also, having AI is actually removing the human part, which is the core of the process. And one of the really important things that we struggled at Labbe at the beginning is actually having the perfect match between the patient and the therapist. And that's actually having a machine only based to provide the therapy is going to remove that aspect. And that's why I think it's not going to be replaced by AI. To you, Dr. Hamid, if you have anything.
I agree that the point here is that when you put the machine, you remove the human. And we as humans are social beings. We need to communicate and we can connect. Real quickly, there are new advancements. I would call them more emerging technologies rather than artificial intelligence. You can use VR to actually put yourself in a state that is controlled and operated by a therapist to give you let's say, a journey where you can really get to know yourself, your feelings, and how you can slowly manage that. It works beautifully with PTSD, post-traumatic stress disorder, and there are solutions. There's also gamifications and gaming where you can play a game and the whole environment is gearing you towards, let's say, instead of leveling up and becoming stronger, it's telling you to solve for the issues that usually youth have. And I'm just going to give a quick point. It's up to people like you who are very fascinated moving forward with the research to bring that here and make it local, because it exists globally. It just needs someone with your mindset and your energy to make a change in people's lives today.
And let's talk after the session.
Yeah.
Other questions? Oh, yeah.
Thank you, everyone, for talking about such an important topic. And I believe the Kingdom is focusing on raising awareness about this issue. And I think we do have the chance to enhance our current mental health and wellness issues. My question is from Ustad Mazen. How do you ensure the quality of service when it comes to therapists and psychiatrists? Because within my circle, within the group, we lack some sort of awareness or a bigger spectrum of issues that are more open to talk about. So how do you ensure the quality of service? And the question to all of you guys is how we can, for each one of you in the different sectors, improve the mental health services.
So a very quick answer for that is we do have a problem with equality. This is definitely everywhere in the world. And having quality at scale is really a big challenge. And this is why we create something called Labbeh Academy. And every single therapist that goes into the platform, they have to go through multiple interviews. And also they have to go through our academy just to make sure that we have the standard level of quality that we try to provide to our users. And the second thing is we're trying so hard to standardize the sessions as well. So we tell the therapist what exactly needed for that patient and how to help them through our whole ecosystem. Because the patient, when they go to the application, they use the assessments, they go to the community, and they start actually interacting with others, and then we start understanding the user maybe more than the therapist at the beginning. And this is what we're trying to do, having technology and also having our Labbeh Academy to have the standard level of quality that we can provide to our users.
Thank you. We have maybe time for just 2 more questions we'll take and we'll answer. I know we have a couple of minutes, so we can keep it quick. Thank you.
My question is for the global shapers within the panel, Rawan and Hamid. What do you think the role of youth is when it comes to breaking the stigma around mental health?
I'll yield
Great
to
question.
Rowan.
Thank you for that question. I think, like I was saying earlier, youth play an important role in our communities because they're very driven. They have a lot of ideas, and some of them are big ideas. They try to think outside of the box as well. And I think the role that they can play in the community is to help, first of all, break the stigma. That is a really big issue that we face. And I think they can play diverse roles within that at various ages, in various populations. And I think what was being said before is that if we can target people at a younger age, so if the youth were to form initiatives of helping younger people understand their emotions, understand their feelings, develop skills of resilience, then there'll be an up-and-coming generation of people that are more able to talk about mental health, to talk about things that are not talked about necessarily in this day and age. They're able to integrate things like AI to form solutions. So there are pros and cons to that, but as we've heard, it's currently used in different spheres in the context of mental health. So it's also, to add to what Dr. Hamid was saying, it's also used in the context of phobias. So if someone has a phobia of spiders, for example, we can use VR and kind of bring it into the room to help them in that therapeutic context. And I think the youth can play a huge role into coming up with different ideas and thinking outside of the box and kind of pushing that drive with their energy. And I'll take that back to Dr. Hamid to let him continue.
I'll be real quick for the time, but number one, build it, they will come. If I have a neighborhood that I want them to become more, let's say, active, I can do a lot of initiatives to make them run, cycle, whatever. But if I build a park in that neighborhood, they'll inherently start to become more active. So build the environments and the safe spaces. Second, the best way to change and manage population health is with communication. So we have the youth voice to share and destigmatize mental health struggles through our networks and our capacity. And finally, we are able to mobilize stakeholders. There's a lot of very important people, whether in technology, whether in policy, whether in psychology or clinical setting, that can be very supportive in fixing at least things at our capacity as youth. So these would be the 3 main aspects that I would focus on as a youth global shaper.
Thank you so much. And we're actually now out of time. So if you do have questions, please do come and feel free to speak to us, the panel, after this. And thank you all so much. I wanted to express thanks to the World Economic Forum and to the Ministry of Economy and Planning for bringing this very important topic to the conversation. A couple of very top-line points to summarize what is a very rich discussion. It's very clear youth are leading this, and there's a call for youth to be really at the center of these solutions. We need greater promotion of good mental health. Let's focus on the positive of good mental health and the returns that brings to individuals, to businesses, to societies, as well as scaling care that is culturally competent. And that role of artistic expression and culture there's a really important role to bring in to make sure that community connectedness as well as individual resilience is strengthened so that everybody can have the chance to live their lives to the fullest. This is a crisis. We're seeing a need collaboration here. We've got an opportunity globally, and there's an opportunity to really lead what is needed for our world right now more than ever. And a huge thanks to our panelists for your time and all of your work. What is an incredibly important global issue for today. Thank you all for your time.
Lisa, if I can, this session is titled Fueling Action Toward Mental Health.